Medicare does not cover everything that traditional insurance covers. And if you listen to the end of this video, I'm going to tell you how to get some of these services covered. So what does Medicare not cover? Well, Medicare does not cover dental services. Remember that all-inclusive plan that you had through your job, or maybe you had a supplement dental plan? Guess what? You might find yourself in the same position as having to get an external plan to help pay what Medicare does not cover. Vision services are not covered with Medicare. Now, let me explain that if you have a disease of the eye, then at that point, Medicare would cover it because it would be considered a medically necessary event. So if you had to see an ophthalmologist because you got glaucoma, that's considered medical. But just regular vision services, such as going to get a routine eye exam, Medicare does not cover. Another service Medicare does not cover is long-term care. Now, one would think, if I need long-term care, wouldn't it be covered? Believe it or not, no, it's not covered. So that means that if you live in a long-term care facility, such as an assisted living, because you need help getting around, or maybe you need help with attending to daily needs, there are some services that are there that will help you. But as far as being covered in a facility, Medicare does not cover. Cosmetic surgery is not covered either. Now, there are times when Medicare will cover cosmetic surgeries, such as, let's say you had breast cancer and you had to get one of your breasts manipulated. And so it would take some reconstruction in order to get you back to normal. And in cases like that, a cosmetic surgery would be covered. But just to enhance your beauty or to enhance your looks, sorry, cosmetic surgeries are not covered. Routine physicals are not covered. Sorry. But for you to do a stress test and all kind of blood panels and different stuff like that, Medicare will not cover a full physical. They will give you a Welcome to Medicare exam, which is basically when you first go on to Medicare. And then they will also allow you to have an annual wellness visit, but you will not have access to a full workup of a blood panel, getting on a treadmill and running it out to get a stress test done and all that kind of stuff. So routine physicals are not covered. It is going to be an out-of-pocket expense. Massage therapy is not covered. That might have been a given, but lately, people have been looking at the medical benefits of massage therapy and how it can relieve stress and different things like that. But unfortunately, getting a massage is not considered medically necessary. Hearing aids and hearing exams are not covered by Medicare. Now, let me point out here that if you need to have a hearing exam done to diagnose or to treat a condition, in a case like that, Medicare would pay for it. But to just have it done on a routine basis and to get hearing aids, sorry, hearing aids are not covered. Concierge services. This is something that has become more popular today that I thought was kind of just extinct. But I'm hearing more and more about these services. To pay a private doctor to come to you on demand is not covered by Medicare, even though you can still have that service if you pay for it, but Medicare will not pay for any concierge care at all. Services you receive from a doctor not willing to accept Medicare assignment. Yep. So even if a doctor does not take Medicare assignment, you could still be on the hook for whatever that doctor charges. Now, let me also say this, if that doctor knows that you are on Medicare, he cannot charge you above the Medicare allowed amount for services, which is 15% above the Medicare allowed amount fee schedule. He can't charge you above that. But it still may be an out-of-pocket expense for you if you go to a doctor who tells you up front that they do not accept Medicare. Now, we looked at some services that Medicare does not pay for, but let's look at Medicare Part D. So there are drugs that fall under not really fall under Part D, but you get them at the pharmacy that Medicare will not pay for. Some of those drugs include fertility drugs, drugs for cosmetic purposes, over-the-counter drugs, drugs to lose weight, drugs to gain weight, drugs for erectile dysfunction, vitamins and minerals, drugs that are considered barbiturates, and drugs that are considered benzodiazepines. A lot of drugs in these categories kind of help you feel good, less depressed, different stuff like that. You would think that they would be medically necessary in some certain cases, but Medicare says no. So, as promised, what are some of the ways that you could get these services covered that Medicare will not cover? Well, the first way is through a Medicare Advantage plan. One of the great things about having an Advantage plan are the additional benefits that you can get, such as dental, vision, and hearing. These are some of the most requested benefits from people going on Medicare that I have ever seen. So a lot of your Medicare Advantage plans now include these services for you to take advantage of. Another benefit to these Medicare Advantage plans is that some of them will give you a quarterly allowance of over-the-counter medications, supplements that you need. Another way to get some of these services that are not covered through Medicare covered is through purchasing a separate plan through a different carrier. There are plans out there that give you coverage for dental, vision, and hearing benefits all wrapped up in one plan. There are also plans out there that offer standalone dental, standalone vision, and standalone hearing benefits that you can take advantage of. There are also long-term care plans that you have to purchase before you turn 65 that pay when or if you have to go into a long-term care facility. And some of these plans do a dynamic and extraordinary job paying to make certain that you're able to live independently and that you're making use of benefiting from all the services that are offered through assisted living or a long-term care facility. And as I mentioned before, concierge service is always available to purchase as a standalone, but understand that Medicare does not cover it, so you would have to pay for it out of pocket. And I have heard that there are great benefits from having a doctor coming to see you versus you going to see a doctor. So just know that that's another benefit that is out there. It's not covered by Medicare, but if you can afford the expense of having a concierge doctor that is able to come see you versus you going to see him, why not take advantage of it? So that's it, everybody. Thank you for watching What Medicare Does Not Cover. And if you want to learn what to do if the doctor refuses to service you, click on this next video. Don't forget to like and subscribe and comment down below and hit the notifications button so that you're aware the next time we upload a video.